So this is part of a grand rounds that I gave in Toronto regarding the use of platelet-rich plasma for uh, treatment of vocal cord scar. So part of the information that I would like to talk about today is the management of vocal fold scar and what can be done today. In addition to the information that I've already presented, this specific portion is to talk about the use of PRP or platelet-rich plasma. I am a consultant to Olympus Medical, and the use of the platelet-rich plasma is still considered off-label use of this material. So the information for the next 5 minutes I'd like to talk about is the use of PRP for scar, thinning of the vocal cord from vocal atrophy, and the scarring condition of the vocal cord called sulcus vocalis. The use of regenerative medicine has received a lot of interest recently, and it is because in your own body you have the necessary material for regeneration. This includes stem cells, this includes growth factors, and the matrix that is necessary for building new tissue. However, because of the healing process in human, it's often turned off as part of the healing process. So the trick here is to try to figure out how to turn that healing process back on for the conditions that we're talking about. So the use of PRP or platelet-rich plasma uses your own blood product, and it's this portion called the platelet-rich plasma portion. It is filled with growth factors and can promote stem cell proliferation and healing. So it's already used in cosmetic surgery quite extensively for facelifts, for hair growth. It's used in orthopedics for tendon repair. What we're using it for is in the vocal folds. And this was first proposed by Dr. Hirano in Japan, but we have also used it for the last 5 years using the platelet-rich plasma. So platelet-rich plasma basically is a cocktail of growth factors which can help promote healing and scar, as well as growth of new tissue into the vocal cords. So when we inject the material, we can inject it through the mouth, as you see here, but we can also inject it through the neck in order to plump up the vocal cords. So here's an example of a young female singer with a vocal cord scar that's being injected with this material through the neck. You can see this is under local anesthesia, and she's tolerating it very well. And this is the injection sort of in live time. You can see the filling of the vocal cord with this material. And the patient usually then goes home straight away and is allowed to use the voice without any difficulties. So far we've done over 200 injections, and this is the part that's been published in our literature on the 60 some patients. And so this is what it looks like after spinning it down, and then we resuspend that. So we draw 20 cc's of blood and spin it down to 1 cc for injection. So what this detail is basically showing that all these patients tolerated the injection very well. The material, the reason we're doing it is mostly for scar, but also for scar and vocal atrophy, which is thinning of the vocal cords. We routinely look at the voice results and look at the vibration characteristics. For this audience, what we want to say is that all these patients were able to tolerate it without too much complications. We did have a couple of people that fainted during the procedure, and we were able to follow them for over a year. So here's a young female with a vocal cord scar. And you can see the issue with the stiffness. And here she is after the procedure, and you can see much better vibration. Here's another patient that has a much worse situation called the sulcus vergature, scarring with vocal cord groove, and you can see the before and then the after injection after 11 months, and she's doing much better. Although there's still hoarseness, she's able to function much better. So I'll skip this data in terms of the objective question and go to this last slide. And that's asking the patient, would you have this done again? And you'll see for people with mild to moderate voice problems, 90% of them said they would do it again because it helped them. For the severe, we're not as successful. Only 50% of the people says yes. So this is a brief summary that the use of PRP is a new and exciting office-based intervention for scar, sulcus, and vocal atrophy. Both the short-term and long-term data suggest that for at least a year, this can be good for patients with mild to moderate voice difficulties. So thank you very much. If you have any questions, please feel free to call my office or go to the website and look at some of the other data, including some of the cases that we have enclosed.